One of the important things that I personally believe we can do, based on experts that I listen to and other experts around the country, is that when we're in public, specifically in places that are dense populations, indoors, wear a mask. It's a suggestion, a very strong suggestion, that you wear a mask. If I'm in a grocery store or in a convenience store, or if I'm in an indoor facility where I'm going to be in close space, where I can't socially distance with people that I'm not normally around, which means I don't know where and who they interact with, I wear a mask. I do it because it not only protects me and my family, but it protects fellow citizens.
In our common areas, chairs will be spaced much like we're standing today, separated, because we know social distancing remains an absolutely essential part of our efforts to care for you and for your comfort. You're likely to see someone from environmental services team stop by and clean surfaces and door handles and chairs, because we're disinfecting with increased frequency today.
I hope that you can hear me with my mask, right? To emphasize, as the mayor has said, the importance of wearing a mask, certainly in public spaces, but also to say it does not interfere with our ability to communicate. The mission of UF Health is to heal, to comfort, to educate, and to discover. Each of those is in full array as we battle COVID in the weeks before and the weeks and probably months to come.
Another way that you can protect yourself and have good health going forward is to make sure that you're seeking out care in a timely fashion. We're seeing many patients with chronic medical conditions who have delayed their care over the last several months. We have very safe environments to provide that care now at each of our healthcare centers. So please, if you need that type of care, don't delay further.
These have been stressful, unprecedented times, difficult times for all of us, and we're seeing increasing rates of mental health and addiction. And if you need help, if you're experiencing anxiety, depression, symptoms of addiction, get the help you need now. At St. Vincent's, you can get that help by going to getjaxhealthcare.com, and we can see you virtually from the convenience of your home, and really want to make sure that we're attending to not just your physical needs, but your mental health needs as well.
Based on the CDC guidelines and guidance that we've gotten, all DoD personnel are required to wear face coverings. So my message to you is, if you come on base, have one. You won't be able to shop, and you certainly won't be able to come into our hospital or any of our health facilities without one. We're maintaining good social distancing, say 6 feet where possible. It's hard to do that in a military environment, but we're adapting and figuring that out. But it's most essential because we're required to have a fighting force ready to go out the door.
When I get out of my car and go into a space that's indoors where there's going to be dense people that I can't operate and respect social distancing, I put the mask on. I happen to make the decision to put it on in a responsible way just before I'm going to be engaged and around people, so it's not on for an unnecessary amount of time. The scientists and the data have said it's not perfect, but it does, if I wear it and you wear it, it lowers the risk.